hello, hello.
Hi.
Hap- Happy Friday, everyone. My name is Monica Balderas. We are here with Prevention Talk this morning. I guess this afternoon. It's noon now. Today I have with me Jennifer Potter. Jennifer, how are you?
Hi, I'm doing well. I hope everybody out there is doing well too.
I am so excited to have you as my host this morning or this afternoon. Jennifer Potter works here at Family Support Services with me. Tell me a little bit about yourself, Jennifer.
Hi, well, I am the loss team coordinator at Family Support Services. I am a licensed master's level social worker and just so excited to be here to talk about our program and just all the good things that are going on in our community and all the good changes happening.
Yes, yes. We're so excited to have you on our team here at Family Support Services. We're so fortunate to have you and your expertise. Today, we're going to talk a little bit about the program that you work in, and we're so excited to bring you some special guests this afternoon. So Prevention Talk. Prevention Talk is a live stream that we've done once a week for the past couple of weeks. We did it so that we can bring you drug and alcohol prevention education, any kind of prevention education, community resources, agency news, and new programs that we're hosting. If you saw at the beginning of this live stream, there is a few little blurbs of groups and programs that are starting here at Family Support Services. And if at any point you have any questions about what our agency does, or if you want to know how to get in contact with our agency, please write down in the comments that you want more information. Um, don't forget to like and share this live stream. That is the best thing that you can do for us, because the more people that see our information, the more people that are going to receive those resources that we have for them. So comment, share, tag your friends, tag your family, tag your babysitter, tag anybody that you think might benefit from today's program. So let's go ahead and get started. We have a lot on our agenda today, so I want to go ahead and get started. Tell us a little bit about the program that we're going to be talking about today, Jennifer.
Yeah, absolutely. So the program is Lost Team, which stands for Local Outreach for Survivors of Suicide. It's something that was brought to our attention from actually the community and community members. I'm excited that one of our panelists is actually one of the people that had this movement idea for Amarillo, and so I'm excited for you to hear from Sarah Williamson. But really and truly, the model is based on this new idea of postvention, which is we've done a lot for the prevention side. And I feel like that our community, society in general, they know about suicide prevention, but what do we do when a suicide has occurred? And so that's really what the focus of this program is. And I'll tell you a little bit more when it comes to some of the facts and just the logistics of our team.
Awesome. Well, let's go ahead and bring Sarah on. Um, let's see. Give us a minute.
Sarah?
Hello.
Awesome. Hi, Sarah. How are you doing?
Good. Thank you, Monica.
Good. I'm so excited that you were able to join us today. We're so grateful for all the work that you've done. Tell us a little bit about yourself.
Thank you, Monica. I'm reaching out to those who are out there listening also. I wish I could see you and see your faces, but so grateful for anyone that's joining or that will join in the future. But I am a wife, a mother, a grandmother. I am a survivor of suicide loss. I'm also a registered nurse with a master's degree. I was an ICU nurse and an educator for 38 plus years of my career. I'm still barely involved in nursing, but I have had a lot of experience actually in the hospital setting with people who survived their attempt, but I was not prepared for my own personal loss. And I lost a grandfather that I never knew before I was born in 1958 to suicide. In 2007, I lost a beloved aunt that I did know. It was his daughter to suicide. And then in 2008, I lost my 18-year-old son to suicide while he was a senior in high school.
I imagine that has impacted your work with this program now here at Family Support Services.
Yes,
I'm so
absolutely.
very sorry for your loss. Tell us a little bit more about how that has influenced your work with Family Support Services.
Well, I was in a very dark place for many years, and I reached out to different services in the Amarillo community after my loss in 2008. But I did see, and I felt like that there were some great things going on, but people were operating in silos, and not everybody knew what everybody else was doing. And so I was doing a lot of surfing the web, and I came across this loss conference, which was going to take place in Fort Worth, Texas in 2015. So I signed up and I went. And that's where I met Dr. Frank Campbell, who is the founder of the concept of the loss team. And this is an outreach of Baton Rouge, their crisis intervention center, and also the National Suicidology Training Center led by Dr. Campbell. This conference was amazing. I felt such healing when I was able to connect with other survivors of suicide and with other mental health care professionals who were very concerned about the problem of suicide in our culture and actually internationally. And Frank, I call him the compassionate Cajun. He has this beautiful Southern accent, and he is the grandfather of compassion.
Wow.
I feel like he's a licensed clinical social worker. And several decades back, he recognized that suicide is a devastating legacy to families. And he wanted to break that multi generational cycle. So he has designed this loss team, and we act as first responders at the scene of a suicide when we are notified and directed under the authority of our police department. I met with Jason Riddlesberger, who at the time was the lead police officer in Amarillo's crisis intervention team, and Amy Horde at Family Support Services. And they just ran with this idea and presented it to other community leaders. They asked me to come speak at the Texas Panhandle Suicide Prevention Coalition, and multiple people just jumped on this idea and this service, and it's amazing what's happened. And Jennifer has already explained that this is a postvention response to suicide. It's different. We are survivors. We didn't survive an attempt. We survived the loss of one of our loved ones to suicide. And so I want to make that distinction that as survivors, we didn't survive an attempt. We survived an actual loss of someone that we loved. So when Loss Team started, there was some research that emerged that showed what's called the phenomenon of 45. And that is, first, that approximately 45 persons are profoundly affected by a suicide loss. Second, a 45-minute visit, first response at the scene of a suicide, or a quick delayed response, reduces the length of time that a survivor seeks help from 4 to 5 years to 4 to 5 months. I could see this in my personal situation. If I had had a loss visit, I think I would have sought services much quicker for myself and my family. It took me actually 7 years to reach out and find services within my community. So I wanted to just end this by saying that the primary goal of a loss team is to stand with bereaved persons of suicide loss on the worst day of their lives and refer them to community resources that can change the legacy of suicide for them and the generations that will follow them. And I want to close this portion of my little talk with a statement that was made by the author of Night Falls Fast, Understanding Suicide. K. Redfield Jameson said, "Death by suicide is not a gentle deathbed gathering. It rips apart lives and beliefs and sets its survivors on a prolonged and devastating journey. As members of loss teams, we offer support, help, healing, and hope immediately to the newly bereaved by suicide."
Wow, that's just amazing, Sarah. I think, when we think of crisis and any crisis situation, when you're in that crisis situation, you don't automatically remember the phone numbers to the hotlines. You don't remember the phone numbers to the counselors. You don't remember the addresses to the resource centers. And so to have a team that works with the agencies that you work with to be able to find those people that are in immediate crisis, I think that's huge because they don't have to reach out. You guys have a process that will put you into those situations to offer support. And so we'll talk about the logistics here in just a little bit of the program, but I just think that's one of the best benefits of this loss program is that if you are in this kind of situation, if you are in this crisis, you guys are going to find them and you're going to make sure that they get the support that they need. Of course, respecting boundaries as you need to, but I think that's the best thing about this program because I know when I've been in crisis, you're just trying to survive and you're just trying to figure out how to live in whatever is going on. And so when those resources are handed to you without you even asking, it's a huge blessing, a huge blessing. So I love that you offer immediate response to those families that are in crisis. Jennifer, tell us a little bit more about the logistics of the program.
Yeah, well, I feel like it's hard to follow Sarah, and I'm just going to say, her testimony and their story in general, it's just no wonder that, public health and family support service and the police department, I mean, they know that this is needed. And there's so many families in the community that have a very similar experience. And so I just wanted to put that out there also that Sarah, thank you for being here and for sharing your story. And we wouldn't be here without you and Paul for sure. So thank you again. Just as far as the loss team, I know that some people try and figure out, what does that actually look like? And so our team is made up of mental health professionals, community advocates, and like Sarah said too, those people that have had suicide loss or been drastically affected by having a suicide loss in their family or a very close friend. We do have a team that we will go out for two different types of responses. There's the active response, which is what Sarah mentions too, where police are on scene. We have had extensive training with police as well as had some guidance from them too of how can we be a benefit when you guys are on scene dealing with the suicide also. And so they've let us know kind of the steps of what that looks like for the investigation piece and things like that, and kind of what's going on behind the scenes as well. And so police, they determined that it is a possible suicide. And so they call our family support service crisis line. And at that time, we have a team that is dispatched. The team is made of a mental health professional and a survivor of suicide that actually go on scene when police are there. Most of the time, the deceased loved one is also still there. And so this is a very shocking and traumatic time for the family, neighbors, close friends, anybody that's there. And our main goal, honestly, is just to be whatever it is that the survivors of suicide and the police need from us at that moment. We could talk about all the resources available, what they're going to need in 3 months and things like that. And they're not going to know, they're not going to be able to comprehend what is going on. One of my favorite quotes that I heard is just give them the privilege of just being devastated. and be in their brains for them. So if it means letting their dog out, if it means putting their groceries away, if it means, is there a safe person that I can call to make sure that you're taken care of tonight? Whatever it is that they need, we're going to be there for them to do it. The other type of response that we can do is called delayed response. And this is where it's a suicide that has happened previously. Police are not on scene. It could have even been within the last year. And family is just ready to kind of seek the what's next. I know I'm in grief. I know I need resources. And where do I need to go at this point? What's available? A lot of people don't know that we have a bereavement center here in Amarillo. I didn't know that BSA Hospice of the Southwest provides grief support groups, and it's not specifically to deal with hospice care. And so there's a lot of information out there. There's definitely some holes, which again, the team is hoping to help and to identify as well. But there are some resources out there, and we want to connect people with counselors that specify with grief loss and specifically suicide. And so that's kind of how our team works on the two types of responses. Sarah mentioned a bunch of the statistics, but I really want to point out too that for our community, Amarillo and Randall, Potter County, we are one of the highest rates when it comes to suicide nationwide. And this is something that, national average, we should be having roughly 20 in the area, and nearly 3 times that. Wow. And so this is why public health has seen this as a crisis. And like Sarah said too, that the people that are left behind after a suicide are trying to figure out what life looks like next. And that's very difficult. And people that have that experience are 5 times more likely to attempt or die by suicide themselves. And so when you do the math of how high our numbers are, plus that, this is a crisis. And so I'm very thankful that our community encourages mental health and sees this as a need and has really stepped up.
Yeah, I think that's amazing. Jennifer, when you say we want to help them be their brain, jump into their brain and think of those things that they might not be thinking about, like putting away their groceries. I always remember that when we had a big death in our family. A car accident happened, and during that time, one of the best gifts that we received, of course, we received beautiful flowers, we received all of those really beautiful things that make us feel good, but one of the best things that I remember receiving that week was my very best friend brought us toilet paper, paper towels, paper plates. She brought us all the necessities that we were going to need that week, and I just remembered how thoughtful. We had family coming in from out of town for funeral services and people coming and going, and it was just one of the most overwhelming weeks that we had ever had. And so we weren't thinking about making sure the toilet paper was replenished, and when she showed up with that, I just thought, wow, how thoughtful. Like, that is one of the best gifts that we've received. And so now when I'm in the situation of blessing somebody in that type of situation, I always try to remember those practical things that we could take to alleviate some of that load that they're feeling, some of the overwhelming things that they might not have time or even the thought to take care of. So I think that's amazing that you guys think about that and that you have a team that focuses on that for families.
Absolutely. And I feel like the main part that makes our team so unique is that role of peer support. And so you will probably have a lot of people that say, I'm thinking about you, I'm praying about you. But then, there's going to be those people too that you need to say, I need somebody to take care of my lawn now. I need some of these tangible things. And so our volunteers they've been through it. They know what those look like. And even just to have people there when you lose somebody to say, I just can't remember anything anymore. And for us to say, that's actually pretty normal for when you're in grief. And so just little things like that to let them know, like, you're not alone. This is the normal reaction.
Right. Well, and Sarah, can you tell us a little bit about that grief after suicide? What that might be like?
Yes, Monica. Thanks for addressing that, or allowing me to address that. And before I make my comments about the nature of suicide grief, I want to preface my comments with saying that I don't want to minimize anyone's grief over any situation. Grief is not a contest, it's not a comparison. But there are some things about the loss of a loved one to suicide that make it a very complicated grief. And we're working on right now forming a consistent support group that's specific to suicide grief versus the grief that someone experiences through the loss of a loved one to an illness or an accident or a natural disaster, something like that.
Right.
Um, so we're working on that. That's in the works. I've attended several support groups over the past. Some were unique to suicide loss, some were not. And it was really that those survivors of suicide, in conjunction with mental health professionals who understood and had empathy for the specific type of grief that I was experiencing. And so but I don't want to minimize any person's grief at all. But I think I've listed here several things that I think have contributed to the complicated and difficult nature of suicide grief. And I come from a Judeo Christian perspective, so I'm not wanting to ignore any community of faith here. I'm just going to speak from my own perspective. I think that as we reach out to survivors of suicide loss, we need to find their place of faith. What is going to help them spiritually in this? But for me, in the Judeo Christian community, there still is a perpetuation that people who die by suicide are going to hell. And this is not found anywhere in Scripture. There are 7 suicides in Scripture. The authors treated these suicides anywhere from ambivalence to fame, almost like Samson, the big guy, the big strong guy who died by suicide, but he took out a bunch of Philistines with him. And Judas, that we all know, betrayed Jesus, but he threw the money back and he repented and then he hung himself. So the scripture does not teach that, but still within the church is that pervasive teaching that is very soul wrenching for us as survivors. And I think that in any faith, it's important that compassion and truth be taught as to the eternal nature of someone's soul who dies by suicide. Particularly now, there is an organization called Lifeway Research that is doing a lot of research in the Christian community on suicide. And they're finding that communities of faith some of them are doing a great job of reaching out to those who are having suicidal thoughts, reaching out to those with mental illness. But there's still a lot of misunderstanding and a lot of cruel things that are still being said. I've heard Christian people say, like my daughter who died of heroin, well, at least she didn't die by suicide. Or another person whose mother died from cancer says, your grief's not any different than mine. Grief is a grief, so right. Don't compare with me. And another person who had a daughter with a chronic illness who was healed wanted to compare her grief process to mine. And I just silently sit there and say, right. Okay, but within myself, I'm raging because I know it's different. So it's different within my community of faith. Great progress is being made, but we still have a long way to go. The second thing about the uniqueness of suicide grief is the way that employers treat us. The Family Medical Leave Act and the Americans with Disabilities Act actually are laws that set down guidelines for employers to follow when they have employees who suffer from mental health issues. And as survivors of suicide, we are 6 to 7 more times likely to die by suicide ourselves. So
wow.
we immediately become mental health issues ourselves.
Mm-hmm.
And so I have found that employers, by and large, I'm not saying everywhere, but they
Mm-hmm.
completely ignore FMLA and ADA, and they will pressure employees into resigning when they start having issues. They will force resignations. They will terminate. They will not renew contracts. And uh, this needs to be stopped. Employers need to be educated and actually find ways to help their employees before they go to the last resort measure. The third thing is that suicide is probably in 90% of the cases preceded by some form of mental illness, whether it is chronic or acute, whether it's diagnosed or undiagnosed. And I think probably even in that 10%, those neural pathways in the brain, the neurochemistry in the brain,
Mm-hmm.
the spirituality of the human being, it is a perfect storm that results in the death of a person by suicide. Mental illness, mental health is still very much misunderstood. And I'm so grateful for the scientists and the physicians that are helping us to understand that mental health is a disease of the brain, or mental health issues are diseases of the brain. And we should be treating our brains like we do our heart, lungs, kidney, that when any disease process or pathology is taking place. That's one of the things that Dr. Frank always says, is that we need to treat the brain like we do the heart.
Right.
The fourth thing about suicide grief is that there's still a lot of language, there are cliches, there are myths that persist in our culture that are horrifically damaging to survivors of suicide loss and people who've attempted suicide. And so we need to start changing the way that we speak, changing the way that we think when we are addressing suicide with bereaved persons. The fifth thing is that unexpected injury or death of a loved one is included in the 10 causes of post traumatic stress disorder. The suicide of a loved one is tantamount to military combat, assault, terrorist attack, emotional, physical, or sexual abuse. It's PTSD.
Yes.
And symptoms of PTSD for us as survivors of suicide are insomnia, substance abuse, lack of motivation, withdrawal from society, quarrelsome or aggressive behavior, nightmares, memory loss, headaches, tachycardia, GI distress. I mean, it's horrific, and we need help. Suicide might follow a person's chronic history of mental illness, but mostly it's unexpected and traumatic. And the guilt that we face as survivors of, especially me, I'm a healthcare professional, I'm a registered nurse. What did I not see? What did I miss? What did I misinterpret? And there's a lot of guilt associated with suicide loss that we as survivors need our mental health care professionals. We need our churches. We need our employers. We need our communities of faith. We need a culturally competent understanding from all persons. And I just want to say that, in completing my statements here, that as SOSers, that's what we call ourselves, survivors of suicide, we all had unique relationships with the person that we lost to suicide. And we are given purpose in serving on lost teams and serving in volunteer capacities to help people within our communities. And I am so very grateful for the people here in Amarillo that are running with this lost team idea. I'm so grateful to be a part of it. I'm so grateful to the God of my faith and the God of my understanding, and on which I lean, on whom I lean every day. And I've had, in spite of my negative experiences through the church or with employers, I've had some amazing people in my churches and my community of faith, my neighbors, friends, people with whom I work, and the new people that I'm getting to know through family support services, the mental health professional community that we have here in Amarillo. Great things are going on, and an incredible day is being planned in September on International Survivors of Suicide Day, and it's going to take place on September 11th. I hope that more information will be coming through family support services. But good things, compassionate things are going on here in Amarillo. And I'm so grateful for the people that are walking beside us, granting us their presence, and who are recognizing that we are a population of people who needs help. And this is a public health issue, just like any disease or virus or anything that's going on. And isolation is not good. And I
Right.
know that we all have different ideas about isolation in our present circumstances, but our present circumstances are showing us the need that human beings need connection, compassion, and community. Thanks, Monica.
I think that's amazing. I love what you said. Compassion is happening here in Amarillo. And I have been witness to that as well. Churches are calling us and they're wanting to be educated on mental health. They're wanting to know how to talk to their youth about, if they have suicidal thoughts, what do their youth leaders need to tell them? We just recently did a training at one of the local churches here in Amarillo to help youth leaders have that conversation with their students. And so I love it because compassion is happening here in Amarillo, and I think it'll continue to happen, especially if we have leaders like you and the rest of the Lost team here initiating that. So I think that's amazing. Going back to what we were talking, what you said about employers letting people go and not really wanting to have those conversations. It all goes back to education. It all goes back. They don't know how to have those conversations. They don't know how to provide that support. And sometimes that's difficult. And it's not that they just they're not smart enough to understand. No, that's a learned skill. Somebody has to teach you how to have those conversations. And so if you are an employer, or if you are a church leader, or a kids maybe a kids club leader, something in a leadership capacity, feel free to reach out to us and reach out to family support services, reach out to the Lost team. And I'm sorry, that's my computer. My computer is connected to my phone. But, reach out to us and let us know that you would just want to know a little bit more about it. And I know that there is a mental health first aid class that you can take, and that will give you all of the information that you need to talk to somebody who might be suicidal. So there's so many conversations that we can have in regards to this. I mean, we have about an hour today. That's definitely not enough time. I do want to go ahead and bring Amber Matthews up on screen with us. Amber Matthews is a mental health professional. Let me get her on screen. Let's see. Hi, Amber. How are you? Oh, I think you're muted. Let's see.
I was,
There you
sorry.
go. You're fine. How
How
are
are
you,
you? I'm doing
Amber?
well. I'm doing well. How about yourself?
I'm doing great. I'm so excited to have you on here with us. Thank you. Thank you for the work that you do. Thank you for being a part of this program. Tell us a little bit about yourself, who you are and what you do.
Well, no, I appreciate the opportunity to be a part of what you guys have going on here, and especially being a part of the Lost team. But I am, like Jennifer, I'm also a licensed master social worker. In fact, I met her in graduate school. But I have had personal experience working with survivors in a few different settings. I worked for a mortuary service for several years in our area, and just realized that grief therapy was an area of mental health that I really wanted to be a part of. And so I worked also for some time at a local children's bereavement center here. And so I worked directly with the survivors of suicide at that agency, and was also through that agency was also able to get involved with our local suicide prevention coalition, which is where I met Ms. Sarah Williamson. So I worked closely with her and Jennifer with the coalition, and then we, of course, discussed a lot of the lost team. And when Family Support Services decided to take on this program, I just was overwhelmed with gratitude and just really excited to get involved. And Jennifer invited me to be a part of it. I was just so thrilled. But you know, with my experience in the field of therapy and bereavement, like Sarah, I've learned that grieving the death of a loved one due to suicide is just specifically, you know, unique. Of course, all grief is different. In fact, you know, the death of anticipating a loved one who dies in the hospital or in hospice is incredibly different than grieving the death of an infant. It's incredibly different than grieving a suicide death. Specifically with a suicide death, as she said, it can be traumatic and complex. And it's usually unexpected and sudden. And of course, that brings about shame. In fact, I actually have a private practice, but I also work at a local, one of our local inpatient psychiatric facilities. And in that, almost every client that I've ever worked with in this field has been impacted some way or another by a suicide death. And many of their stories are a lot, you know, in the moment of learning of the suicide. Well, and especially with those who were the ones who found the deceased. It can be, among many things, traumatic, confusing, bewildering. I've heard people say it's completely derailing. They're just lost, and I've even heard them say a grief or a fog. You know, that initial fog right after learning about the death, overwhelming shock. Again, they're lost and they have no idea what to do next. So, you know, the main purpose, as Jennifer said, of the lost team is to provide that initial support, you know, of what the family needs on scene. Obviously with the police need on scene as well, but specifically for family members, and to offer that support and comfort, especially from another suicide survivor. But also, I think that it's important to mention, you know, the guidance and connection to a mental health professional on scene. And as Sarah said earlier, survivors suffer from that mental health issues, especially as a result of the suicide. But I feel like there is still a stigma or sense of shame associated with seeking counseling services. And I feel like this program really is filling a gap. It's providing, you know, that survivor with the opportunity to meet a mental health professional on scene. It helps break down those barriers of the unknown, of people who have especially never sought therapy before. And I think that it helps establish a familiar face in the mental health community, which my hope is that it will make them more likely to seek supportive services in the future, like support groups and counseling, of course. I think that both types of support offer a different dynamic. They're both very, very important. I think they couple well with each other. In fact, I recommend a lot to my clients. You know, there is, you know, therapy over here individual therapy that can help a person, you know, guide them through their unique experience. And then support groups or other, you know, establishing relationships with other mental health professionals, other survivors of suicide that can offer a shared experience that's totally different than, you know, individual therapy. And I think that this really helps individuals feel less alone in their grief journey. Counselors and therapists can especially help survivors build coping skills. We can help them process those, unique experiences of a suicide loss, as Sarah shared with us, the stigma, the shame, the guilt. But I think that also, as counselors, we can help an individual understand the process of their trauma related to that grief a little bit more and explore those unanswered questions. The person with the answers to their questions is gone, and so the individuals or the survivors are left with a lot of questions. But also, as mental health professionals, I think that we can help as survivors understand maybe some of the psychiatric problems that the deceased may have been suffering from, if that particular thing might be helpful in their grief journey. But we need this program, this loss program. Just kind of in closing, I think that we really need this program. Bridges the gap between survivor and supportive services, whether that is establishing a relationship with a suicide survivor, seeking supportive services like group therapy or counseling services, or hopefully all of them. But just especially as a post-vention effort, as Sarah said, whenever we experience the loss of a loved one due to suicide, we are in fact more likely to experience suicidal ideation and maybe complete as well. But like I said, it's just really important, and I just feel extremely blessed to be part of this post-vention effort. And hopefully through this we get to see a decrease in self-inflicted deaths in the wake of a suicide.
I think that's amazing. Thank you so much, Amber, for what you do and all the work that you've put into this project and into your practice. It's definitely needed. I work full time in the prevention side of things, alcohol and drug prevention, different things like that. But it's so nice to know that when things get to the extreme, there are support services and there are resources for those families. And so I am so grateful to know that each one of you are working in that direction. So thank you guys for helping us so much. Now, Jennifer, I want to bring you back on screen and tell us a little bit more about the needs that the program has, how to volunteer. Tell us a little bit about that.
We are completely volunteer based, besides myself and my clinical supervisor. And so everything that you heard us do, all the materials, everything, it's based on our volunteer time and people that just want to make a difference in our community and are just pouring out their love through the many hours that they serve with being on call. Even as far as we have other things too, that maybe on call isn't necessarily something that you are being called to do, or you feel like that's not the best fit. And following up with the families, we need people to support the people that are on call and our volunteers. This is hard work. And even though we have a lot of fun. We laugh with each other. We love each other, and our meetings are often a lot of fun-based things. Even the heavy topic that we're discussing, that they still need support, and it's still very hard when you go on scene. And I know for me, and I'm sure it's the same for all the volunteers too, that it's difficult to go from responding to a call and being in the darkest moment with the family to coming home to your own family and pretending as if nothing happened, and to switch roles. And so we need people to support our volunteers. We need community support. We need people to outreach for the program in general and word of mouth that this is here, and to encourage others to give us a call. And then we need the tangible things as well. We like to give our survivors that are responding different snacks, water bottles. There's binders, there's materials that we need for our program as well, meals for our trainings, just basically anything as far as that goes as well. There is a number at the bottom of the screen for anybody that needs more resources or has any questions. You can call me. And if you have an idea of some way that we could help, of course, donations are always welcomed. As of right now, one of the major needs that we see for people is that we are seeking funding for counseling services, so that those people that are lower income or don't have insurance that covers mental health, that they have some sort of outlet or something so that they can start seeking counseling. Another thing too is scene restoration. That has been a major need, and one thing that I feel like with this program that was discovered, nobody handles scene restoration. It's the family that has to make those arrangements, and so being that support for the family, and again, it's costly. And so having donations specific for scene restorations is definitely a need and something that we're seeking as well.
Awesome. I think that's just amazing. Now, if community members want to be a part of the actual Lost team, do you guys, do you accept volunteers for the Lost team?
We do. As far as being on the response team part, we do want to try and make that where it is a mental health professional, like a first responder or somebody that kind of knows what that experience is like, as well as a survivor of suicide. Again, it can be very triggering and difficult work. And so we do want to ensure that you're going to be taken care of and ready for that type of role as well. And but we do want people, and like I said, there's other roles too and other things that we need for support as well. So community advocates, just somebody that cares and wants to make a difference and wants to help with lowering our suicide rates. Absolutely, please come to Family Support Services. There's an online application at the Family Support Services website. You can definitely call me. I can walk you through what that process looks like, and if you have other ideas of ways that maybe I haven't thought of that you can volunteer, but it's a need, come join us.
Awesome. And guys, I promise you, you want to get to know Jennifer. Jennifer is an amazing person, an amazing leader. I'm sure these ladies can attest to that. So if you have an interest in providing support to survivors of suicide, contact Jennifer and see how she can get you connected to that. Because like you've heard throughout this live stream, there is definitely a need for that. So I want to end with one last question for everybody. And we'll go ahead and start with you, Amber. Let me make sure that we can hear you. Amber,
Oh, yeah.
if you could give just one tip or word of advice to friends and family member of survivors of suicide, what would that tip be?
Seek support. In graduate school for social work, but also undergrad for psychology, I remember an instructor told me even counselors need counseling. And so it was really kind of eye-opening to the fact that we all need help at some point or another. And I think that especially with a death in general, it's hard. There's no manual. There's no ideal way to navigate. We hear stages or phases or whatever of grief, but it's nothing like that. And in fact, as a survivor myself, I am a suicide survivor myself, and so I think that this program is specific, to allowing us to, as a mental health professional, being able to be that light to illuminate that others. It's dark, and so I just really hope that as a suicide survivor, that you don't feel there's no shame and there's no guilt that you should feel. You might, but it's okay for you to seek services. We are here to help. Whether or not you want to talk with somebody who has experience with your specific loss, or if you want to talk to a mental health professional who has the education and the resources to help you see through that dark, kind of like I said, be that flashlight to illuminate that. We all need that sometime. And again, like I said, even including mental health professionals.
Yeah, I think that's awesome. And Amber, what does it mean to you to be a part of this team?
This as a mental health professional, like kind of like Jennifer was discussing, it gets really hard as a person who tries to support everyone else. It's nice to be a part of, I guess, a family that we have, of others who share that vision of helping support survivors of suicide. Being a helper, being a part of the team has, you know, not only that, I'm sorry, like I said, I'm a survivor as well. We're part of this club that nobody wanted to be part of. None of us wanted to be a part of it. But now we're a part of this club as survivors. But as a mental health professional, it's just really meaningful to me, the relationships and the camaraderie that I'm building with other mental health professionals. And like I said, as even counselors need counseling, but even counselors need support from other people who are in the field of mental health, and so who can provide that shared experience. Again, this is a unique thing that we are trying to intervene with, and so again, as a professional in the field, it's nice to have other professionals who you can just be around and be a part of for that support.
That's awesome. Thank you so much, Amber. Thank you for the work that you do. Thank you for just being an advocate for those families. We appreciate you.
Yeah, I
Alrighty.
just I feel blessed. Thank you. Appreciate it.
Yes, yes. Alrighty, Sarah. Tell us if you could give just one tip or word of advice to friends or family of suicide survivors, what would that advice be?
Well, when you look at all the statistics on suicide, if you don't have a loved one there, it's difficult to have empathy for those people. But behind every statistic on suicide is a person, and that person's death has affected multiple people. You don't have to be a survivor of suicide yourself or a mental health professional to reach out to someone who is a survivor of suicide loss. Just be a compassionate friend. What we need is your presence. We don't need a lot of words. We don't need cliches. We don't need myths. We don't need false comfort. And sometimes it's better to say nothing than to say something that is hurtful. And presence is more important than anything. Don't shun us, don't distance yourself from us. If we are someone you work with, if we're someone in your community of faith, if we're your neighbor, if we're in your family, just call us, ring the doorbell. I don't like texting. I got lots of beautiful handwritten notes, but a quick phone call, a quick visit, a quick note were some of the most meaningful things to me. And sometimes they came from complete strangers. So it's okay, even if you don't know a person well, to reach out to them if they are a survivor of suicide loss.
I think that's amazing advice. Thank you so much, Sarah. And what does it mean to be a part of this team to you?
Uh, this team, I'll get tearful here. Um, it's been 13 years since I lost my son. And this team has given me purpose and hope that I've been looking for a long, long time. And sweet Jennifer, I've known her since she was in sixth grade. She grew up with my oldest son, and she's an incredible person. And Amber is an incredible person. All the people, Jason Riddlesberger, Amy Horde, our Lost Team volunteers, the people on the Suicide Prevention Coalition have been so amazing in the Amarillo community. And I know this whole idea, this whole compassionate movement is going to spread like wildfire through our world, and it gives me so much hope, and I'm grateful.
Thank you so much, Sarah. That was beautiful. We're so fortunate that you're a part of this team. I will continue to say that over and over again because each one of you offers something completely different but completely needed. So we're so grateful to have you. Thank you so much. Jennifer, same question for you. Um, well, maybe. Let's see. Here in just a little bit, we'll get Jennifer back on and ask her the same question. You know, Amber and Sarah have put in so much time, so much work into this project. And I think, Sarah, can you tell me about how long has the Lost program been um, going?
Well, the original Lost team was started in 1998 in Baton Rouge. It's been spreading across the nation. The last conference I attended, I think there were about 12 states in the nation that had teams in various cities. But here in Amarillo, Frank Campbell and Leslie Culver did a training in the fall of 19. I spoke before the coalition, Suicide Prevention Coalition, in May of 19. So we actually started December 1st, and
Wow.
we've gone on quite a few calls since then. And we don't like to be called, but we're there, and we're grateful to be there, and we're going to keep going.
Wow. Well, thank you so much. It looked like Jennifer tried to jump back on, but I think it might have kicked her off again. I wanted to give just a little bit of time for her to tell us what this program means to her. If for some reason she doesn't jump back on right away, I will make sure that we find a way to get you her answer in the comments of this live stream. If you have any more, if you want any more information, if you're watching this live stream and you think, man, my family can really benefit from this, or I want to be a part of this program, please feel free to call our agency and contact Jennifer Potter. Her phone number is 806-342-2549, and her email is jpotter@fss-ama.org. She can get you connected to who you need to talk to train for this program. I know that there's an extensive training for this program, so they're not just going to throw you out and hope that you get it right. They're going to make sure that you're prepared to talk to these families. They're going to make sure that you have the words, you have the resources. And so if you want to volunteer, if you want more information, definitely give Jennifer a call so that we can get you connected to the program and to this resource. Once again, thank you so much, Amber. Thank you so much, Sarah. Thank you, Jennifer. Although she's not on here right now, I just want to express how grateful we are to have this team here at Family Support Services and to have her leadership. Jennifer is coming on in the comments. She says, "This is Jennifer. I have the best team ever. I am just fortunate to learn from these amazing individuals. School is one thing, but this is real life experiences." I think that's amazing. Thank you so much, Jennifer. Thank you so much for everything that you do. Thank you so much for your leadership. Thank you, each of you, for the heart that you have for your community, and for stepping out in faith and doing something big. And you know, I really think compassion is going to be a ripple effect here in Amarillo, and it's going to start with this program. So thank you so much. Thank you to our viewers, those of you that have been watching live with us since noon. If you have any questions or if you need to get a hold of us, you know how to find us. Contact us in our messages, in the comments, or shoot us a Facebook message. Thank you guys so much. You guys have a good day.
Thank you, Monica.
Bye.
Bye. Thanks
Bye.
a lot.